Welcome to today's Medicare 360 show. Let's continue with our Medicare New Handbook 2025. We are at page 34, section 2, find out what Medicare covers. Let's go to the half of the page where it says chronic care management services. If you have 2 or more serious conditions like arthritis and diabetes that you expect to last at least a year, Medicare may pay for healthcare providers' help to manage those conditions. This includes a comprehensive care plan that lists your health problems and goals, other providers, medications, community services, and you have a need and other health information. It also explains the care you need and how it will be coordinated. If you agree to this service, your provider will prepare the care plan for you or your caregiver, help you with medication management, provide 24/7 access for urgent care management needs, give you support when you go from one healthcare setting to another, and help you with other chronic care needs. You pay a monthly fee and the Part B deductible and coinsurance applies. If you have supplemental insurance, including Medicaid, it may help cover the monthly fee. On a side note, there are Medicare Advantage plans that are geared towards chronic care management, be it, example, like diabetes, heart conditions. With these type of plans, they do give you extra benefits, and those extra benefits are like your grocery card, your utility card, you name it. There's some plans that give you pest control. What else do they give? A humidifier. So things of that nature that definitely will help you with your healthcare journey. Chronic pain management and treatment services. Medicare covers monthly services for people living with chronic pain, persistent or recurring pain lasting longer than 3 months. Service may include pain assessments, medication management, and care coordination and planning. The Part B deductible and coinsurance apply. Clinical, where is that? Um, One second. Okay, clinical research studies. Clinical research studies test how well different types of medical care work and if they're safe, like how well a cancer drug works. For certain clinical research studies, Medicare covers some costs, like office visits and tests. You may pay 20% of the Medicare approved amount depending on the treatment you get. The Part B deductible may apply. Let's see. Okay. Now we are on page 35. Note, if you are in a Medicare Advantage plan, Original Medicare may cover some costs along with your Medicare Advantage plan. Contact your plan for details about coverage for clinical research studies. Cognitive assessment and care plan services. When you visit your provider, including your yearly wellness visit, they may perform a cognitive assessment to look for signs of dementia, including Alzheimer's. Signs of cognitive impairment include trouble remembering, learning new things, concentrating, managing finances, or making decisions. Conditions like depression, anxiety, and delirium could also cause confusion. So it's important to understand why you may be having symptoms. Medicare covers a separate visit with a doctor or healthcare provider to do a full review of your cognitive function. Establish or confirm a diagnosis like dementia or Alzheimer's disease and develop a care plan. You could bring someone with you, like a spouse, friend, or caregiver, to help provide information and answer questions. During the visit, your doctor or healthcare provider may perform an exam, talk with you about your medical history, and review your medication. Identify your social supports, including care that your usual caregiver can provide. Create a care plan to help address and manage your symptoms. Help you develop or update your advanced care plan. Go to pages 30 to 31. Refer you to a specialist if needed. Help you understand more about community resources like rehabilitation services, adult health program, and support groups. The Part B deductible and co-insurance may apply. What's new? Some people living with dementia and their family and unpaid caregivers may be able to get additional support through the Guiding an Improved Dementia Experience Model Pilot Program. Talk to your provider for more information and to find out if they participate. This is definitely, I would see, more concerning, that I've been seeing more seniors or my clients' parents having cognitive disabilities such as Alzheimer's and dementia. It's definitely really important to start planning for this because caregiver support, which is probably the number one thing that a person will need for their loved one, is not covered by Medicare. So that's the biggest thing. Recently, I had an agent who had actually, her client, she just changed his plan to a different type of plan, healthy, everything, but then got rushed to the ER, found out that he has cancer, and so forth. He doesn't have any relatives, friends, anyone could help support him. And he's just been asking for that extra help on his Medicare insurance plan. And really, there's one offs or maybe respite care where they alleviate that help that you do get from your consistent caregiver, but there's not something that's 24-hour care, or I would say just having a regular caregiver. So in this case, he wanted to stay at the hospital, right? Because then he would get meals, he would get some care. But if the hospital does not approve and does not think, or when they review your information, your chart, that doesn't warrant for you to be at the hospital, they are not going to just keep you there because you need a caregiver or no one's going to watch you, right? So keep that in mind. And there's definitely planning involved, which I would say plan early or on life to get some type of long-term care insurance. There's different types depending on your needs, your assets, the affordability, but something like that. So when you get into your 70s, 80s, 90s, that you're not stressing over who's going to take care of you, especially with your family, because I know a lot of fights, disagreements happen between family members with a level of care. I've seen many times where someone, a loved one, feels like they're handling all the care, but not compensated or even appreciated by other family members. And other family members may just say give more input to the issues at hand. So there's just a lot of family disagreements that I've been noticing, and that may be avoided with proper planning on the long-term care portion, because long-term care is not covered by Medicare. So, preventive services, colorectal cancer screenings. Medicare does cover these screenings to help find precancerous growths or find cancer early when treatment is most effective. Medicare may cover one or more of these screening tests. Computed, computed tomography, CT, colonography, I know Medicare inside out, but it is very hard for me to talk about these terminology terms. Okay, just to pronounce them. Medicare covers the screening test once every 24 months. And if you're 45 or older at a high risk for colorectal cancer, if you aren't at high risk, Medicare covers the test once every 60 months or 48 months after previous sigmoidoscopy or colonoscopy. You pay nothing if your doctor or other healthcare provider accepts assignment. Screening, um, screening colonoscopies. Medicare covers the screening test once every 120 months or every 24 months if you're at high risk, or 48 months after previous flexible sigmoidoscopy. There's no minimum age requirement. If you initially have a non-invasive stool-based screening test, fecal occult blood test, or multi-target stool DNA test, and receive a positive result, Medicare also covers a follow-up colonoscopy as a screening test. You pay nothing for the screening test if your doctor or other qualified healthcare provider accepts assignment. Flexible sigmoidoscopies. Medicare covers this test once every 48 months if you're 45 or older, or 120 months after previous screening colonoscopy if you aren't high risk. You pay nothing for a test if your doctor or qualified healthcare provider accepts assignment. So this holds true just as long as they take assignment or gets the approvals for that referral, you're okay, right? What's not okay is when you just say, pick up the phone and want this type of screening and it wasn't referred, approved, or your doctor didn't take assignment. That's when the issues come arise, and that's when you are paying more. If your doctor finds and removes a polyp or other tissue during the colonoscopy or flexible sigmoidoscopy, you pay 15% of the Medicare approved amount for your doctor's services. In a hospital outpatient setting, you pay the hospital a 15% coinsurance. The Part B deductible doesn't apply. We are on page 36 if you're following along. Fecal occult blood test. Medicare covers a screening test once every 12 months. If you're 45 or older, you pay nothing for the test if your doctor or other qualified healthcare provider accepts assignment. Multi-targeted stool DNA and blood-based biomarker test. Medicare covers a screening test once every 3 years. If you meet all the conditions, you are between 45 to 85. You show no symptoms of colorectal disease, including but not limited to lower gastrointestinal pain, blood and stool, a positive Gualac fecal occult blood test, or fecal immunochemical test. If you're at average risk for developing colorectal cancer, meaning you have no personal history of endometriose polyps, colorectal cancer, or inflammatory bowel disease, including Crohn's disease and ulcerative colitis. If you have no family history of colorectal cancer or endometrious polyps, familiar endometrious polyposis, or hereditary non-polyposis colorectal cancer. Oh my gosh, that was long. Okay, multiple target stool DNA tests are at home lab tests. Blood-based biomarker tests are conducted in a lab. You pay nothing for these tests if your doctor or other qualified healthcare provider accepts assignments. Usually, if you don't want to get a colonoscopy, you want something less invasive, this is definitely something you could look at. But in my opinion, I would just take the colonoscopy test. Okay, let's continue to continuous positive airway pressure, CPAP devices and accessories. This is something that I've seen more often now as well. Medicare may cover 3-month trial CPAP devices and accessories if you've been diagnosed with obstructive sleep apnea. After the trial period, Medicare may continue to cover CPAP devices and accessories if you meet with your doctor in person and your doctor documents in your medical record that you meet certain conditions and the CPAP is helping you. You pay 20% of the Medicare approved amount for the machine rental and purchase of related supplies like mask and tubing. The Part B deductible applies. Medicare pays a supplier to rent the machine for 13 months if you've been using it without interruption. After you rented the machine for 13 months, you'll own it. So this is definitely the case. Sometimes when someone switches from one plan to another, we do have to talk to the vendor to make sure that you could keep the machine, or sometimes they will want you to send it back. But know that there is that 13 months, you'll own it. And then depending on the plan as well, it may be covered 100%. It may not. You may have a 20% coinsurance. Just really depends on your plan. So let us help you figure that out. Note, Medicare may cover a rental or replacement CPAP machine and or CPAP accessory if you have a CPAP machine before you got Medicare and you meet certain requirements. So that's like the transition if you do have a CPAP machine before you get onto Medicare. Okay, let us go to page 37. Preventive service. Counseling to prevent tobacco use and tobacco-caused disease. Medicare covers up to 8 face-to-face visits in a 12-month period if you use tobacco. You pay nothing for the counseling sessions if your doctor or other qualified health provider accepts assignment. COVID-19, coronavirus disease 2019. Many people with Medicare are at higher risk for serious COVID-19 illness, so it's important to take the necessary steps to keep yourself and others safe. Medicare covers several test items and services related to COVID-19. Talk with your doctor or healthcare provider to find out which are right for you. Preventive services, COVID-19 vaccines. FDA approved and FDA authorized vaccines help reduce the risk of illness from COVID-19 by working with the body's natural defenses to safely develop immunity protection against the virus. You pay nothing for the COVID-19 vaccine if your doctor or other qualified care provider accepts assignments for giving you the shot. Be sure to bring your red, white, and blue Medicare card when you get the vaccine so your healthcare provider or pharmacy can bill Medicare. If you are in a Medicare Advantage plan, you must use a card from your plan to get your Medicare covered services. You pay nothing when you get the vaccine from an in-network or provider. Check with your plan for more information. That is a big thing. Sometimes when a pharmacy administers this, or you go to those clinics, it may not be covered. You need to make sure that your plan covers it before you take the service, right? Unless you're okay paying out of pocket. So keep that in mind with all of your services that you get, that they are covered before you actually do the service. Diagnostic laboratory tests. These tests check to see if you have COVID-19. You pay nothing when a healthcare provider orders this test, and you get it from a laboratory, pharmacy, doctor, or hospital that takes Medicare. If you're in a Medicare Advantage plan, check with your plan to find out if you have any out-of-pocket costs. Okay. Monoclonal antibody treatments and products. These FDA authorized or approved treatments can help fight the disease and keep you out of the hospital. You must test positive for COVID-19 and have mild to moderate symptoms and be at high risk for progressing to severe COVID-19 and other needing hospitalization. Original Medicare will cover monoclonal antibody treatments if you have COVID-19 symptoms. You pay nothing for these treatments when you get them from a Medicare provider or supplier. You must meet certain conditions to qualify. If you're in a Medicare Advantage plan, check with your plan about your coverage and costs. Certain FDA authorized or approved monoclonal antibody products can protect you before you're exposed to COVID-19. If you are Part B and your doctor decides this type of product could work for you, like if you have a weakened immune system, you pay nothing for the product when you get it from a Medicare provider or supplier. Get more information, learn about these covered services at medicare.gov/medicare-coronavirus. For more on COVID-19, visit cd.gov/COVID. We are on page 38 now. Defibrillators. Medicare may cover an implantable cardioverter defibrillator if you've been diagnosed with heart failure. The surgery takes place in an outpatient setting. You pay 20% of the Medicare approved amount for your doctor's services. You also pay a copayment. Most cases, a copayment can't be more than the Part A hospital stay deductible. The Part B deductible applies. Part A costs surgeries. Part A covers surgeries to implant defibrillators in an inpatient hospital setting. Go to inpatient hospital pages 27 to 28. Preventive service depression screening. Medicare covers one depression screening per year. The screening must be done in a primary care setting, like a doctor's office, that could provide follow-up treatment and or referrals. You pay nothing for the screening if your doctor accepts assignments. If you or someone you know is struggling in crisis and would like to talk to a trained counselor, call or text 988, the free and confidential suicide and crisis lifeline. You also can connect with a counselor through web chat at 988lifeline.org. Diabetes equipment, supplies, and therapeutic shoes. Medicare covers meters and continuous glucose monitor used to estimate your blood sugar level, and related supplies including test strips, lancet holders, sensors, and control solutions. Medicare also covers tubing, insertion sets, and insulin for patients using insulin pumps and sensors, transmitters, and receivers for patients using continuous glucose monitors. In addition, Medicare covers one pair of extra def or custom shoes and inserts per year for people with specific diabetes-related foot problems. You pay 20% of the Medicare approved amount if your supplier accepts assignment. The Part B deductible applies. Important, Medicare drug coverage Part D may cover insulin you inject yourself, certain medical supplies used to inject insulin like syringes, disposable pumps, and some oral diabetes sugar. Check with your plan for more information. The cost of 1 month's supply of each covered insulin product is capped at $35. Go to page 88. Similar caps on costs apply for traditional insulin used in Part B covered insulin pumps. So more on this really depends on the type of plan you have. If you have original Medicare with a supplement, this should be covered. Also, if you have a Medicare Advantage plan, depending on the plan you have, depends on the brand names that you could get. So keep that in mind when switching plans. And there are diabetes companies that could definitely help you out. So you don't have to worry about ordering yourself. They will help assist you with all those things. So we are going to stop there. We are going to keep going with diabetes screening next time. So thank you for tuning in. I will see you guys next week. Once again, this is Jennifer Lee, your Medicare 360 show host. Have a wonderful day. Bye-bye.